When we consider hair loss treatments, there is quite a spectrum. It might start with things that you can apply to your scalp, and there are preparations available over the counter in pharmacies, and then there are the prescription versions that we might use in a clinic. And when I use topical medications that are applied to the scalp, they will be formulated specifically for you, as per my assessment of your hair loss and your lifestyle, and also your genetic analysis. So topical preparations are one option. Tablets can also be used. This may be supplements or again prescription medications that can help us to address your hair loss. In-clinic treatments can involve things like microneedling, so we can use a microneedling device in combination with growth factors or stem cells, or in combination with platelet-rich plasma, which is a component of your blood. So it's something that is wholly yours that we can re-inject into the scalp to stimulate hair growth. And at the most extreme end of the spectrum is hair transplant surgery, and this isn't something that we personally offer, although I work very closely with some of the best surgeons in the business, and I'm very happy to recommend a surgeon if I think that's the best route for you to go.